And for several reasons. One, it's a great workout. For those of you who don't come, it's always different. It's a pretty friendly place. And I think the third reason is probably the chit chat. And the chit chat really ends up happening, and you really realize that you're not alone in a lot of things that are going through your life. You know, everything from kids to school. And the number one thing that comes up constantly is growing old and all the things that come.
I guess I'm gonna leave now.
And all the things that come along. Hi. That come along with growing old. And you realize you're not alone in that area either. We all have the same things in different phases. Probably the only person who doesn't is Aisha, because she could be my daughter, but.
And Lane, who just walked in.
Oh, are you 20-something too?
No, she's younger than me.
Oh, what?
Oh, yeah, we'll take, that's right, well, yes,
Too bad the car
So, where was I?
About getting old. We're all getting old together.
Getting old. And the one reason why we come here is obviously because we're trying really hard not to let getting old get too far ahead of us. But the one reason that's always out there behind us is health. And so, you know, we're all doing what we can, but really there's a lot of things that are probably out of our control or in our control, but we're not aware of it. I've gone to Trish. She helped me through the worst time of my life and helped me through the best time of my life. And she is not your typical doctor, and because her kids are my kids and she was my neighbor for several years, you could talk to her about anything. And she is here we go.
No. Listen, I was swamped yesterday, so sorry. Okay. Oh, don't worry about it. Okay.
I was going to say some really nice things, but all right. She took a call during my speech.
Sorry. It's one of my medical school friends.
Okay, bottom line is that she said something to me one time, and that is, my mom has Alzheimer's. She researches constantly. Anytime something research comes out on Alzheimer's, she is at my door, this in my mailbox, pills in my mailbox. She doesn't want to be the one that tells me that I have it. She doesn't want to be the one that tells anybody that they have cancer. And so she is so ambitious and over the top about preventative care for cancer. So there you go. That's why we're here.
So I'm Therese Hughes. I have two little boys, 9 and 12. I live in Lake Forest. I went to Loyola Medical School. For medical school, I practiced at I did my training at St. Francis in OB-GYN. So 4 years, and I've been at Highland Park since 1999 with Rich Adis, Dory Becker, Brenda Kim. We have an office in Highland Park, and then we have an office in Buffalo. So I've been there in private practice for 15 years. And, you know, so I'm 45, and as we were getting older, a couple of my patients that I was close to, because a lot of my patients are my age, and they started coming in, especially one that Sarah, who actually was 36 weeks pregnant during 9/11 and had to run down 50 flights of stairs in the Sears Tower. And so she came in to me one year, and she's like, okay, listen, 2 of my friends have been diagnosed with breast cancer. I'm freaking out. What can I do? And so, you know, you hear about the whole thing as self-breast exams, mammograms, but I'm like, isn't there something more that we can do? And as moms, what I really wanted to go into in medicine was cardiac surgery, which is really cool, or trauma surgery, but it really doesn't aim towards a family. However, I like the influence that I have in OB-GYN as moms to influence our family and to say, what can I do to just change things up just a little bit so that they get a little bit better nutrition and a little bit better in their diet. So that's where I kind of started looking for. And I'm not looking at like drastic changes. I am looking at simple changes that can be made in you and your family's lifestyle and diet. Okay, so first I brought a bunch of my favorite books. I'm going to go through that. First I'm going to start with mammograms because there's newest thing on that. Second, I'll start with diet. And then I feel bad because Camille, she's like, can you talk about perimenopause? I'm like, oh my God, I can go on forever on perimenopause. But I'm like, the cancer, especially with Breast Cancer Awareness Month, is my biggest thing. And anyone who likes this, I do during the month of October, except for yesterday because it was crazy. I do something on my Facebook page to decrease your risk of cancer every day during the month of October. I had two close friends, Corey and Alexis, who I started doing this for 3 years ago. I said, hey, you know what? I'm going to post a thing every day. Alexis was first diagnosed. She was 36 years old when she was 13 weeks pregnant with her second child. And I delivered her second child. She went through chemo while she was pregnant. You can go through chemo while you're pregnant. Not all agents. And delivered Anna. And then she got her third agent of chemo. Then my other friend Corey was diagnosed when she was 41. She was 1 year. Her child was 1 year old. And so they are survivors. They are 3 and 2.5 years out, and I've heard all the cancer stories and everything like that, but I'm like, if you guys can go through that, I can at least try to get other people to decrease their incidence. So I'm just gonna pass these around, and these are just my favorite. This is a real old one, this Power Foods book. I don't know if you guys wanna take a look at that one. Dr. Weil's books are actually pretty good. There's a list in here about the 19 best foods, but he goes into like the best, like cooking, you know, to avoid any scratched Teflon pans and the whole thing about, I know, barbecuing, because barbecuing is not the best. So those are things you can take a look at. This is one of my all-time favorite books. David Servan-Schreiber was diagnosed with a brain tumor. He unfortunately passed away in 2011 or 2012 after surviving 20 years with a brain tumor. This is a phenomenal book. It's terrific. This book is written by Richard Bellevue. There's a patient that sends me stuff like all the time, and she recommended this last year. This is awesome. Richard Bellevue is the guru of healthy foods in Canada. He has a lab up in Canada. He refers to him constantly in this book. This is an awesome book, and I get a lot of my information out of that for my blogs and stuff. This is one of my all-time favorite books. I don't know if you guys have heard of the Tutu Project by Bob Carey. Bob Carey's wife has breast cancer, and he is a foundation that helps people that can't afford mammograms get mammograms, and also get rides to treatment, rides to chemo, rides to radiation, all of that stuff. He sells his pictures. It's an awesome book. These books are $50. He has signed pictures. It's a great thing. It's called the Tutu Project. He has it's on Facebook and everything like that. One of my favorite all-time books. This book, actually, one of my third close friends, patients, and then turned into a friend, Andrea, told me I have to get this. Has anyone ever heard of Holly Jacobs? Okay, so a couple years ago, unfortunately, one of my very good friends who's a pediatrician lost her mom to breast cancer when she was 49. She was a sophomore in high school. So she told me about Holly's blog about 2 or 3 years ago. It's called The Silver Pen. Holly Jacobs is a nurse and a social worker, and actually she was probably at Loyola when I was there. For anyone that you know of that is diagnosed or going through breast cancer treatment, this is like your best friend talking to you. This is what Alexis and Corey tell me about all the time. Like where to go for the best wig, where to go. It's a phenomenal, great book for anyone that has breast cancer. She has these little lifelines in here, like spray your scarf with lavender to avoid any smells from the chemo. I mean, just like simple stuff that like Corey and Alexis tell me to tell my patients, because they've been through it all, so I listen to them. Okay, Radical Remission. Kelly Turner talked up in Lake Bluff recently. This is a great book, but it is for people that have, this is like people that have had like the bad actors, pancreatic cancer, stomach cancer, brain cancer, that have gone into remission. What she did is she interviewed about 1,000 people that have had these really bad cancers and found that there was a common link about 8 different things that they did that they think attributed to their remission. Great book, a little too heavily weighted. on Eastern medicine, okay? What I believe in chemotherapy, I believe in conventional chemotherapy and radiation, but I believe in doing everything possible. This is for a little too heavily weighted on Eastern medicine, but still a good one. And then this is my last one.
Wait, can I say something?
Yeah.
Does anyone want a piece of paper and pen? We're also taping this and we're gonna put it on YouTube.
And you guys can look at my,
If you want paper.
but look, you know what, that Silver Lining, I cannot, that book is like phenomenal. And you know what kills me is that Andrea, Holly Jacobs was up here about 2 months ago, and she was downtown yesterday. And I was on call, and I was like, and my Annie, my friend whose mom died of breast cancer 25 years ago, was there at the talk at the library. It was for the Chicago Library. And I was like, oh my God, I would have gone up to her and been like, okay, healing spices. I will totally talk about turmeric. I love turmeric. It's a great spice. I take it as a supplement. Bharat Agrawal is a PhD at MD Anderson. He is the guru on turmeric. His website is www.curcumin.research.org. Curcumin is the active component of turmeric. This is his life's work, okay? He has published a ton of stuff. He has done a ton of research. I will tell you about turmeric after I tell you about mammograms, because that is my all-time favorite that I like to tell people about right away. Okay, so first, mammograms. Everyone, I recommend a baseline at age 35 and then 40 in every year thereafter. There is debate in the medical community between 40 and 50 whether you should get it every year or every other year. After 50, everyone's in agreement that you should get it every year. Now, the thing with mammograms is that it will pick up cancer 3 to 5 years before you feel it, okay? So why not the heck get it every year? I mean, people are like, it hurts. I'm like, you know what, try chemo, okay? Yeah. Seriously. I mean, or, you know, I don't have time. And I'm like, well, try making time for radiation and stuff like that, believe me. So I do recommend MAMs. I also recommend self-breast exams. My patients that have been younger than 40, that have breast cancer have caught it themselves because they don't get mammograms annually. So I recommend both of them. The biggest thing in mammograms right now is what you do if you have dense breast tissue. Okay, so you got a mammogram, your report says you have dense breast tissue, and it almost looks like someone came up to me and said, are the radiologists not reading well? Because are they just putting an exclusion so that they can kind of like get out of it if you have breast cancer? No, you either have dense breast tissue or you have some more fatty breast tissue. Fatty breast tissue appears black. I should have brought one of the MAMs. Fatty breast tissue you can see through because it appears black. Dense breast tissue appears white. You can't see if there's a mass in there, okay? There was a woman on the East Coast who was actually a social worker or something like that, who got regular mammograms and was diagnosed with stage 3 breast cancer. And she's like, wait a minute, what gives? You know, I got my mammograms, what happened? Well, with dense breast tissue, you cannot pick up breast cancer as easy. So we think first that about 60% of false negative mammograms are due to dense breast tissue. Having dense breast tissue, though, increases your risk of breast cancer by 5 to 6 times because you have less fat and more breast tissue. Now, you can't be like, oh, I have dense breast tissue. No, the only way to tell dense breast tissue is on a mammogram. So this woman on the East Coast who found out that she had stage 3 breast cancer after normal mammograms, she started up legislation that said that the radiologists have to write in whether you have dense breast tissue or not. So
And turmeric tablets?
Yeah.
So where do you find those?
you can get them from Amazon.
Yeah.
You can get them directly. I get them directly from Gaia, or you can get them from Whole Foods. And Gaia products are on sale this month at Whole Foods.
Okay, but it's not turmeric, the spice turmeric.
It is the
That's
spiced
what I'm
turmeric in a
asking.
tablet with black pepper.
That's what I want.
I'm trying to pull up this one.
So you're, so using the spice in your cooking
Yeah,
and.
the problem is I don't.
As more, as more as you can get, the better.
Yeah.
But
So
you're
when I
taking a
cook,
tablet.
when I cook like ground beef, sprinkle
Me
in
too.
turmeric, sprinkle in the black pepper.
Costco has a huge turmeric. It says olive oil, turmeric, everything.
Yeah.
And you don't even, the kids don't
And the
know.
kids don't notice it.
Nobody knows
It's a natural ingredient in yellow mustard.
Yeah.
Yeah.
They put it in curry too.
Yeah. Oh God, yeah, yeah, yeah.
And isn't it, I heard that if you add it with black pepper, it's more
Absorb.
It increases absorption. Yeah. Wait, I'm trying to pull up this website. So I highly recommend turmeric. The other thing is that as far as the anti-inflammatory, it's as strong as like, is this coming up? It's as strong as like Vioxx. I mean, it's a strong anti-inflammatory. Wait, hold on, let me just pull this up. Research. What do you think about supplements in general? I think it varies which one. I'll talk about vitamin D too, because I love vitamin D. So humanresearch.org.
You spell that.
Right.
Yes, CURCUMIN research.org. Okay, so it was so funny because I was recently at a shower for one of my cousins, and one of my cousins who's in her early 60s came up to me, and she's a little heavy set, and her knees have always bothered her. She goes, "Oh my God, started turmeric 3 weeks ago. I like don't ache anymore." I mean, seriously, I had another patient. Actually, it was a Sunday that she told me that, and then I came to the office on Monday, and one of my patients who has fibromyalgia, she's like, "Thank you so much for telling me about turmeric." She goes, "I take it, no problems." She goes, "I do not feel my fibromyalgia when I don't take it. I get it back." So, I mean, it's just like a natural anti-inflammatory. It's an anti-cancer agent. This is how I kind of came across it, is because unfortunately I deal a lot with HPV, human papillomavirus, because it's associated with cervical cancer and all my pap smears and stuff like that. And so people are like, okay, I'm like, well, you have HPV. And they're like, well, what can I do about it? I'm like, well, really nothing. Except he has shown that it's effective against HPV. Agarwal has. So anyways, I mean, it's worth it. It's worth a try. But it's great for any inflammatory disease. For some reason, I can't pull up that website. It's great for any inflammatory disease. It's an anti-cancer. It's just preventative. I love it. So that's.
You take 2 pills a day?
I take 2. So I wrote Agarwal because I have like written him. I wrote him about, there was a teacher's husband that had melanoma, and he said he takes 500. So each of those Gaia tablets are 400. So I just take 800 because I figure he's Indian. He has it in his food. So I'm like, oh well, he probably gets like 300 in his food, you know. So I'm like, I'll just take like 2.
Math.
Yeah, exactly. Because for melanoma, he said 2 tablets 3 times a day. But I'm like, you know what? Just pretend you're Indian. It's in your food. People are like, do you start to smell like? No. But I have had so many patients say it really has made a difference. And you know what? I'm sorry. My dad's family has Alzheimer's, and again, I also worry about Camille's family. But my dad's family has Alzheimer's, so I'm like, Dad, whatever. You know, I'm blueberry. At first, I was like blueberries, and then when I came across the turmeric, I'm like turmeric. And now, vitamin D. Okay. So vitamin D, I do take as a supplement. Vitamin D deficiency is associated with breast cancer. The big 5 are breast cancer, colon cancer, Parkinson's, MS, and heart disease. In the first week of August, while we were on vacation, there was a study that came out that is now associated, a deficiency is associated with Alzheimer's. So the range of vitamin D is 32 to 100. I get anyone with breast cancer, colon cancer, MS. You know, the incidence of MS or multiple sclerosis increases as you go away from the equator. So the people closest to the equator don't get it as often.
We have to move.
Exactly.
We have to move.
So I like to get anyone with my high risk into 50 to 70. But now it is associated with Alzheimer's too. So and you know what? My lowest person used to be a 9, and she was a pharmacist at Walgreens. I won't tell you which Walgreens, but she was Korean, and she was lactose intolerant. So she's like, I burn when I go out into the sun, and I don't drink any milk. And I'm like, okay. But recently, and I could kick myself, one of my patients that's been with me for a while that's had breast cancer, she's black, and I said, let's just check your vitamin D. We were talking about preventative stuff. I checked her vitamin D, 5.
Oh my God.
5. I was like, okay. So not only is vitamin D good for just prevention, people feel a heck of a lot better when their vitamin D is in range. So it's worth a try. So as a supplement, I take turmeric. I take black elderberry too. I can go over that, but that's just for immunity. And then D, and I take a baby aspirin. It's controversial. It was funny because I just did a thing on, I didn't do a thing on probiotics. I talked to another group, they asked me about probiotics. I talked to one of our GI guys, and baby aspirin, if you don't have ulcers or any GI disease, it's been shown to be preventative against colon cancer. So I do take a baby aspirin. Yeah.
Taking pills all day long.
Well, I was going to comment on something else, but the baby aspirin is for prevention of colon cancer?
Mm-hmm.
Oh, it was for stroke?
It's stroke. I mean, baby aspirin. So it's stroke, but it's also colon cancer.
No, I was just going to share, because I thought it was interesting, that a year ago when I had a blood test and I asked my doctor to screen for vitamin D.
Yeah.
And they said, we don't do that. And I said, what, really? Because it had been recommended?
Yeah.
I said, no, because everyone in this area is
It's
deficient.
efficient, right?
So we don't even screen. I'm like, well, go ahead.
Okay,
and
listen.
screen.
Yeah.
So it
Well, a lot of
gives us
people are like, people do say, oh, my doctor tested for that. I'm like, really? And some of them do, and some of them don't. And I'm like,
They said
you know
they
what?
stopped testing.
Okay, so there's enough data that's out there, and also the main guy, and I didn't bring the vitamin D book because it's a little bit more. Does anyone know Ann Doppenberg? She lives in Ann Dowd, Ann Doppenberg. Her kids go to I think the high school maybe by now. Anyways, it's her brother that wrote this vitamin D book. And there's enough data out there. Also, people feel better. My patients feel better when their vitamin D is in range, so why the heck not? But my high-risk patients, I make sure that they're tested, and just to make sure. And my MS patients.
But you can't OD on vitamin D.
Yes, you can. You can get up to 100. Okay, so you can go on beyond 100. My highest patient, okay, is a retired policewoman. She exercises like a fiend, and she looks like the Bandy Soleil woman. And she took vitamin D supplementation. She was 89. That's the highest. I took her off of the supplementation. I mean, she's like bronze, and she was taking vitamin D. And I'm like, let's just check it just to make sure to see if you need that supplement or not. And she was 89. I'm like, stop the supplement. You're gonna, maybe start out during the winter if you know. So.
So I have a question in regard to the vitamin D supplement. As opposed to taking something that you can buy over the counter and taking on a daily basis versus something, and I hate to be this like, oh, this is what I did, but taking a supplement that you take once a week, so it's like a gradual release.
Okay.
I mean, is there a difference?
I don't think there's a difference.
Okay.
So I was starting people off, if they were like in their high, okay, can I tell you, most of the people that I test are between 25 to 30, okay? So and you know what? I tested someone today. Who is it? It's someone that I know. No, it's a patient that I know, and I can't remember. She's taking 5,000 a day, and she's only 27. So I upped her to 10,000 3 times a week, and then 5,000. We used to, like, if you were deficient, you can give, and you'll see some endocrinologists or some primary care physicians give 50,000 once a week. It's prescription dose.
Okay.
I think it's the same. I mean, I just started them on because 5,000's at Costco and it's cheap, so the prescription might be higher.
So you think it's about the same
Yeah, I think
thing?
it's about the same.
Because
I think it's fine.
I've gotten mixed reviews,
No, I think it's the same.
more notably from a family member who is a retired physician.
Yeah, I think
and,
it's fine.
okay.
Whatever, as long as you get your levels up.
That's what I thought, but
Yeah, I don't notice a difference. So that's my thing. Vitamin D and turmeric are like my big things, especially again the Alzheimer's thing. I like the anti-cancer thing I'm really big with, but the Alzheimer's thing I'm like it's like one of my things.
There's no Alzheimer's in India.
There's no Alzheimer's in India. It's not an Indian disease.
And people don't die early, they do live long.
They do live longer. They do. They smell like her, but they live longer. But no, there is. There's Alzheimer's. Alzheimer's is not an Indian disease.
Wow.
So, okay. So, getting on to food stuff like cancer. So, this is like, again, one of my favorite books. And my kids, like if you ask, it was so funny because I said I gave Mrs. So-and-so a bottle of turmeric and they're like, oh no. And I'm like, okay, you know, because they know that like turmeric, they're like anti-cancer. So, I love this is like one of my favorite titles of the Cancer Hates Cabbage. Okay. The cruciferous vegetables, broccoli, kale, cauliflower, Brussels sprouts, cabbage, all decrease your risk of breast cancer. Okay, it significantly decreases your risk of breast cancer. So we have a lot of broccoli. I mean, there are certain, you know, I fix the kids, and again, my thing is, you know, I don't go like off the wall and go to acupuncture and stuff like that. I just make little changes in the diet that I can just bring into my family's diet. So we have a lot of broccoli. I do buy it organic. And I just posted something recently about the Dirty Dozen versus the Clean 15. Broccoli, I don't know whether it's one of them, but broccoli is not an expensive vegetable to buy organic. And lettuce isn't either, and celery isn't either. And celery I know is with the Dirty Dozen.
What's a dirty dozen?
The Dirty Dozen is the more contaminated fruits and vegetables as opposed to the cleaner ones. Like berries, I'll give you an example. Berries is one of the Dirty Dozen. Strawberries are like the most contaminated. The problem is that I could probably spend $10 a day feeding each kid organic berries a day. I mean, I would go through so much money, you know, buying organic berries. And so there, in one of the books, it says, you know, the benefits of the antioxidants far outweigh the contaminants. So just wash it well. So, I mean, if I can buy organic berries, I do, but if not. So getting back to the cabbage, there is everything in this book, it's based, and it's just like 8 chapters of the most significant foods you can have. And there's a substance in these cruciferous vegetables that does decrease your risk of breast cancer. Okay, so, or cancers in general. In specific with this one is breast cancer. Okay, berries in another one, garlic and onions. I can just go through garlic and onions. And I forgot about this. Oh wait, one thing with broccoli. Do not buy frozen. You can buy frozen berries. Don't buy frozen broccoli. It decreases the freezing process, takes out some of the chemicals that fight cancer. But you can buy frozen berries; it doesn't take it away.
Would you say that's the same for spinach?
I believe spinach is not a big cancer fighter. Spinach is not a big cancer fighter. Yeah. But just don't buy frozen broccoli. But you can buy frozen berries. Don't buy frozen broccoli. And actually salmon, which I actually did a thing on recently. If you buy frozen salmon, it takes it away. It takes about 30% of the omega-3 away by the freezing process. So anyways, but you know what the thing is that, okay, would you rather have some omega-3 than none of it, okay? So people, because I gave a talk recently to another group, and they were like, oh, you gotta go do this and do this and do this. And I'm like, well, you know what? Okay, listen. They're like, well, the berries are really contaminated. I'm like, okay, either my kids get berries or they don't, okay? So I would rather have them get some antioxidants than to get none. Okay, garlic and onion, and I just, by going through this every October, and I do some of the same things although I tried to update some of the things, garlic and onions are great for GI cancers. Very good for GI, for stomach, and for colon cancer, and for esophageal cancer. Fantastic. It's a big cancer fighter. And actually, in the middle, Camille, in that book, you know, like in the middle there, they say for each cancer what the best food is. In that middle section there, I love that. It'll rank like, yeah, is it past that? No, it's not.
It's this.
No. Here, it's this one. It says it ranks each cancer and then says which food is best. Oh, I brought you a effective book. There.
Yeah.
So anyway.
Wow. Lung cancer, 100% with garlic.
Yeah, I mean it's just and all of these things have
of cancer cell growth.
Okay, so the other thing I did recently was pancreatic because unfortunately there was who's the photographer's wife who died, Mrs. Fitzgerald, who died of pancreatic cancer, and pancreatic just scares me. It's very uncommon, but it scares you because it's people die. hardly anyone survives. So pancreatic cancer, the big thing that you can do for that is celery, artichoke, and parsley. It has apigenin, and applied to it's a substance that's in that applied to pancreatic cells destroys about 40% of that. So as a result of that, like my kids primarily eat spinach souffle. Their vegetable at night is either carrots, spinach souffle. I haven't been able to get them to eat kale chips yet, or broccoli, roasted broccoli. Sometimes they have cauliflower, but I started giving them, as a result, I just started giving them celery, or else putting celery in my foodstuff salad and stuff like that, because I really just didn't even realize that. And then the artichoke too.
How much celery?
They didn't go into that specifically, but they just said celery is really good. Also, vitamin C, E, and selenium, which is in Brazil nuts, are good for pancreatic too. So
With what else?
C, E, and selenium. I'm not going to go into soy; it's too controversial. Turmeric, the anti-cancer spice. It's huge. It's all over the place. Green tea is very good as opposed to coffee. There's certain teas, you gotta brew your tea. There's certain teas, there's Chinese teas and Japanese teas, and it's the EGCG. EGCG is an anti-angiogenesis agent that's in these teas. And what happens is for cancer to grow, it needs to have blood supply. So it grows new blood vessels. And that's called angiogenesis, meaning it's formation of new blood vessels. Anti-angiogenesis is foods that can actually cut off the blood supply. Green tea, huge component of anti-angiogenesis. But unfortunately, you gotta brew it for about 8 to 10 minutes. People brew it too shortly, and you don't get all the substance in it. So if you go to Starbucks and you want to get a coffee or a tea, get a green tea, and so that would help.
And you could mix it with other teas. That's what I do every morning.
Oh, really?
So then you don't taste the green, if you don't like the taste of the
Green tea,
So like
yeah.
vanilla rooibos with green tea is awesome.
Okay, tomatoes, excellent for men, big with prostate, huge with prostate. There's a substance in there that has that. I think I'm going through like the majority. I just did dark chocolate today on my post. It has a lot of anti-cancer agents.
And we have some here.
Yeah, exactly. With acai, which is awesome. Milk chocolate, but if you eat chocolate with milk, it decreases your polyphenol intake, so you don't get as many, you don't get the nutritional value or the anti-cancer value that if you get. That's why it's pure dark chocolate. But pure dark chocolate has more polyphenols than what you get with a glass of green tea. Wow. Oh yeah, it's phenomenal.
That's an easy
You have to get, that's a total easy one. I mean, that's what I look for. So, but you have to get 70% cocoa, at least 70% cocoa. Mm-hmm. Does anyone have any questions on that at all? I went over that, because then I can go on to Camille's thing about perimenopause.
This is not going on YouTube.
No, no. I'll just speak in general terms. No. Okay. No, does anyone have any questions about the anti-cancer? I mean, exercise, obviously. Weight has been. This is the other thing. I'm so sorry. It's huge in his book, and he explains it right away. High protein, low glycemic index foods. Sugar feeds cancer. He has a chapter in that book, in that anti-cancer book. Sugar feeds cancer. And so he recommends either agave nectar. He does like stevia, although I don't know. I don't know. I'm mixed. I mean, we don't eat. I mean, I let my kids have cookies and stuff like that, but we don't use a lot of sugar in the house, so it doesn't matter. But sugar feeds cancer, and he hates processed sugar and he hates processed flour. You can now get white whole wheat flour. I mean, you can get different types of flour. And also, if people don't like wheat bread, get sourdough. It is not white bread. It is not white flour. It's not white processed flour. But he rants in that book about how sugar feeds cancer. And actually, if you have cancer, I'm not sure if you guys realize this or if anyone has had a PET scan. A PET scan is where they scan you're diagnosed with cancer, breast cancer, whatever, and they're looking for metastasis. So you have to go on this sugar-free diet for 3 or 4 days. I forget. I should have asked Corey Alexis. They give you a bolus of sugar. Corey had this breast, and she said, I could totally feel when they gave me the bolus of sugar, it went all to this breast. She goes, I can just feel this huge wave. So, I mean, sugar feeds cancer. Avoid white flour and avoid white sugar. So, that's his biggest thing,
Just back on the vitamin D,
Yeah.
you talked about supplements. What about drinking milk?
Okay, good question, because he goes into, I did not feed my kids, I did not get them organic milk until I read this about the bovine hormones. And he explains it very easily. And you can always borrow my book and just return. He explains the whole thing about organic milk really simply in a way that I could understand it, because it's kind of sometimes hard to understand. So I think milk is, I think it's good for calcium and stuff like that, especially for boys, but I do recommend organic. And you're not getting a huge supply of vitamin D in that. Because people are like, oh, I take a vitamin. I'm getting, and I said, how much is your vitamin? 400. I'm like, that's like nothing for vitamin D.
Okay.
In this
So
climate.
for our kids, organic.
Right.
Skim.
Just milk. It's just the
Whatever.
fat.
Okay,
Yeah.
so what about for old ladies? What about milk for
Okay, so
the moms?
you know what? I'm not too big. What other way you want to get in your calcium? So for calcium, for postmenopausal women, people that have, so people are like, am I in menopause? They're like, when was your last period? Well, last month. I said, no, you're not in menopause. Menopause is defined as a year without a period. So if you're gone a year without a period, that's menopause. So that's 1,500 milligrams of calcium a day. Perimenopause or anyone other than that is 1,250. Okay. So for people that say, oh, I don't eat any cheese, I don't drink any milk, and I eat no yogurt, they're getting at least 300, because spinach has, there's a lot of things that have calcium in that you don't realize it. So you're getting at least 300. So you don't, now this is the other thing is that calcium tablets now come with the vitamin D. So people say they're deficient in vitamin D, oh, I'll just take more of my calcium supplements. I go, no. I got kidney stones after my second child because I was eating Tums like candy and I wasn't drinking enough water. So I said, no. Don't get kidney stones. Don't overdose on your calcium just because you need to get in your vitamin D. Get a separate vitamin D tablet. So as far as milk and over women, I don't care how much you get in as long as you get in calcium. But the key thing is full osteoporosis screening, which I start a year after menopause. You want to get in adequate calcium, but you also want to make sure their vitamin D levels are adequate. Because the vitamin D matters with osteoporosis just as much as the calcium does. So you could be getting in adequate calcium, but your vitamin D could be in the gutter. So, yeah.
What about omega-3?
Omega-3 is excellent. Okay, so I just posted, did you read that post the other day? Okay, so omega-3s are awesome. It really lowers your cholesterol. I had a patient, okay, so fish is a great source of omega-3. Chia seeds are a great source of omega-3, and flax seeds are a great source of omega-3. I had a patient, so my sister started, our family's cholesterol is a little bit high. My sister was like maxed out on her diet, maxed out on her exercise. She started flax, a tablespoon of ground flax once a day lowered her cholesterol. My dad did the same thing. My mom, who constantly complains about any medication she tries for her cholesterol, took a tablespoon every other day and lowered it by 15 points. I go, imagine what you could do if you took it every day, Mom. Then I had another patient who had a high cholesterol and was maxed out on her diet and maxed out on her exercise. And her doctor wanted to start medication. She goes, I really don't want to start medication. I said, you know what? Have him talk him into giving you 3 months. Take flax once a day. She lowered it by 30 points. She didn't need to go on medication. So omega-3 is great for they're good for my pregnant patients because they have shown effect in brain development of children, of infants, and fetuses, and good for heart protection. Yeah, but again, with frozen fish, you are losing some of that. But again, is it better to eat frozen fish or no fish at all? Whatever.
Why do you take black elderberry? Sorry, go ahead.
Yeah, go ahead.
If you buy, as far as I know, there are no salmon to be caught here.
Right.
So-
Well, you can get it like during the summer from fresh Alaskan salmon.
Yes.
Yeah, exactly, and not
But-
farm raised with it.
Right,
Yeah.
but when it comes here, it's frozen,
Right.
flash frozen, wild caught.
Right, but flash frozen still decreases, I believe. I mean, you're still getting a significant amount of omega-3s in.
Especially with the wild caught.
Yeah. So black elderberry is, you know what, I just started it last year. Wait, was it in February? Black elderberry is a immune supplement. It's made, a lot of people made it. The trade name is Sombucol, Solmbucol. So this is a spray on black elderberry, and I take it daily. My dad reads the Wall Street Journal daily and sends us all pertinent articles related to our professions. So anyways, I know, in your articles, I get the Wall Street Journal, I'm like, he just keeps me informed of the Wall Street Journal. So I had this horrible cold, and on one Wednesday I was on call, I was going into patients' rooms, and it was just gross. And my dad sent me this article on black elderberry the day before, and it's just an immune supplement. And if you look on the cabinets, or if you look at like Walgreens and stuff, there's a lot of it, and I didn't realize what it is. So I looked it up, I'm like, oh, it seems, it's like eating 1,000 blueberries. Fine. So I call the pharmacist at CVS, right on 41, the new one, right close to the hospital, and I'm like, do you guys have any of this Sombucol? And he goes, funny you should ask. I used to own my own pharmacy in like an ethnic area, and he used to sell it like crazy. And he goes, it's really like an ethnic, it's like an ethnic thing. And I said, I go, does it work? And he goes, yeah, I really think it works. It's just boosting your immune system. I really think what cancer is going to come down to is how good your immune system is. I really think it's all based on immune system, and this whole thing about foods and exercise and diet and how healthy you keep yourself is what cancer comes down to. Anyway, so I picked it up right after office hours. I took a thing of it. I took one thing when I went to bed. And I go, can I give it to my kids? He goes, yeah. He goes, you just got to be careful with diabetics because the syrup is really sweet, which it totally is. Like seriously, the next day, no cold symptoms, and I had all my energy back. I was like, what? It was bizarre. So I'm like, okay, yeah, because the thing is that it's a syrup. It's a syrup.
Every day?
No, when they get sick. I take it daily. But my husband just had a horrible cold that I had to give him antibiotics for the last 2 weeks, and I didn't get it. So, anyways, but I take it daily. But with pediatrics, they won't let you give them anything.
for cold. Wait, the cold.
They won't let the kids give you. They won't let you.
They don't give antibiotics. They say there's.
Yeah, I know. There's no. And also, my pediatric friends are like, the only thing that works is Benadryl that knocks them out and helps them sleep. But that's the only thing they'll let you give them. So I'm like, okay, let's try some Sombucol. I mean, it's just like, it's like taking 1,000 blueberries.
It's not homeopathic though, is it? Or not?
It's like a homeopathic. It's called black elderberry. But it goes by different names. Yeah.
Okay.
But Gaia makes one that's a tablet. So I just take it daily. Yeah, I mean, but seriously, I took it daily. My husband was like,
Can you write down again what you take daily?
Yeah, I mean, I take turmeric, I take D, baby aspirin, and black elderberry.
Okay, you had said you think cancer is going to come down to diet, exercise.
I think it's all immune system. And actually, that's what they're working on right now. They're working on there's a they're working on a melanoma vaccine right now. And what the melanoma vaccine is supposed to do is supposed to boost your T cells to fight off. T cells is a antibody. And they think that they're working on the vaccine right now to boost your T cells to have the T cells fight off the melanoma.
So how would that work if they actually perfect it? So us as adults would start to take that vaccination?
Okay, but so getting back to your comment.
But right now, immune therapy, it's really based on your immune system. I mean,
what about the healthy people who get cancer?
I know, that's what I can't explain. Well, some of them, there is a familial component in some people. Okay, so only like 10% of people are like, well, breast cancer is not in my family. Well, breast cancer is only about 10% familial. Ovarian cancer more so. But it's more like 20%. Melanoma, there's a strong familial, like 10-20%. There's a strong familial component because it's more common. So, yeah. Mm-hmm.
So would you say
melanoma though? What was I reading about melanoma? I'm forgetting. I had a patient that had a vaginal melanoma once. I mean, melanoma can appear anywhere. Oh, it was horrible. Yeah.
Would you say lifestyle outweighs genetics, or is it hard to make that call?
I think it's well, I think you can't beat the genetics right now. I think the genetic modification and what they're working with to modify the genes and the whole gene sequencing thing.
But if you're like predisposed to something, but you live a completely different lifestyle than say your grandparent did,
I think it's hard to outweigh their predisposition, especially like in Lynch syndrome and stuff like that, and BRCA. I mean, you can't now. Okay, so as far as ovarian is concerned, BRCA is breast and ovarian cancer, more common in the Jewish population. Okay, so as far as ovarian cancer is concerned, because people don't like ovarian cancer. It's a bad act, it's a bad actor. So ovarian cancer protection, what can you do? You can take the birth control pill. You can, so the main things is you can have your ovaries taken out for high risk patients. You can take the birth control pill. The birth control pill decreases your risk of ovarian cancer, and it stays decreased for 10 years off of the pill. Also, anyone that's had tubal ligation, you're decreasing your risk by 50%.
Wow.
Quick question though.
If you get what?
A tubal.
Oh.
Your risk is decreased by 50%.
So being on the pill, does that increase your risk for breast cancer?
Controversial. No, we do not think so. We do. I read something recently, but a lot of people have come out and say no. I mean, the majority of people, no. There was something I read recently, and I don't believe it. But there was one little thing that I read recently, and I forgot what it was in. Anyways, but I don't, The benefits of the pill, I think, far outweigh any risk, but there is no risk of breast cancer.
What about hysterectomy?
Hysterectomy, so, if I have a patient with a breast and ovarian cancer, I take out their ovaries. I take out their ovaries and tubes, because now they do think that possibly the ovarian cancer is starting in the tubes. But hysterectomies are just for uterine. And uterine is...
It doesn't affect the breast cancer?
No. Oh, it's the ovaries that you want to take out for the breast. Yeah. Okay, so this can guide me in. Does anyone have any questions, or do you guys want me to stop? Because I could just do a quick thing on perimenopausal. Because this is what Camille wanted in the first place.
No.
Okay, well, no, because we were talking. Because this is the question that I always get. Can you do a blood test to see when I'm going to go into menopause? No, okay? No, I get the question all the time. The average age of menopause is 51.3 years old. Menopause, people say, am I in menopause? I just had my period last month. No. No, menopause is defined as a year without a period. People say, I think I'm in perimenopause. They come in, they're 48, they're 49. They're like, I think I'm in perimenopause. I said, yes, you're 48 and 49. You're perimenopausal. I mean, yes, you're definitely.
You're perimenopausal for what, 10 years?
Yeah, it averages about 10 years. Okay, the first changes that occur is the periods get heavier, closer together, further apart, and everywhere in between. Okay? They get lighter. Sometimes they can get heavier because of fibroids or polyps or something like that. But the main thing is when I start to see this change in the cycles, people don't ovulate every cycle as they get older. And that is completely normal. The problem is if you don't ovulate every month, during the first half of the month, estrogen is produced by the follicle. After you ovulate, progesterone is produced. Progesterone normally lasts in a regular cycle for 14 days. If you don't get pregnant, then the corpus luteum shuts the progesterone production off and you get a period. So what happens is when you get older, you get estrogen production. You don't get ovulation. You get more estrogen production. The tissue builds up and builds up and builds up and just bleeds off whenever it wants to. Okay? So what we do, and it never completely bleeds off. And this can lead, in some cases, not every case, to overgrowth or hyperplasia, which is a precursor to cancer, because you never get that progesterone production to allow it to completely bleed off. So what I do, what we warn our patients about is if they have bleeding less than 21 days apart, and I always say, if you have a period less than 21 days apart, well, I just had a little spotting, I just had 2 or 3 days of bleeding, that really doesn't count. I said, yes, it does count. So any bleeding less than 21 days apart or greater than 60 days apart, you call us. Because if it's greater than 60 days apart, I'm going to give you Provera to bring about a period. And if it's less than 21 days apart, I'm going to biopsy you to make sure that you don't have overgrowth. Okay? And then what I'll do is I'll just watch these people and just either I'll cycle regulate them I love the Mirena IUD right now. The Mirena IUD is the progesterone producing IUD. I put people on low-dose pills. Low-dose pills are great because you're getting ovarian cancer protection, you're getting cycle regulation, but also the women that are having some flashes, because they're having the fluctuations of estrogen, then it levels them out. So it's a really kind of a nice idea for that. Sometimes people say, can you test my hormones? I'm bleeding 18 days apart, but can I test your hormones? No, because the thing is, and I'm not sure what Rick Rack does, but that's whatever. Anyways, but if I can tell you, your hormones are going to be fluctuating at this time, and that's why your periods are wacky. So whatever I do, people are saying, can you test my hormones? I said, okay, well, if I test your hormones, can I put you on the pill or cycle regulate? Absolutely no. Well, then why are we testing your hormones? Okay, like there's no point to it. So that's what I watch out for, and that's, I think, one of the first signs is these irregular cycles. So less than 21-day cycles, greater than 60 days cycles, right through bleeding in between. And then come the night sweats. The night sweats can sometimes even come before that. But I've had people that, in the weight gain, I check everyone's thyroid. I have yet to find, I don't think I've found an abnormal thyroid in the last 6 months. But I do check everyone's thyroid because it comes right around the middle. And huge recent study, the increase, that people complain about weight gain around the middle in menopause, increased risk of diabetes, but just a recent study out in the last 2 or 3 weeks out of London. It's a nice study that was done for increased breast cancer risk, and they showed that if you go up a skirt size, and it's nice because they're not measuring anyone's waist, they're going by the women's skirt size, so it's a really nice comparison, and you can really easily relate to it. If you go up a skirt size, I think it's like 24 to 30% increased risk of breast cancer. If you go up 2 skirt sizes, you have a 60 to 70 increased chance of breast cancer. So it's really the adipose tissue around the waist, but that's what everyone complains about.
Wait, does that happen in menopause?
Menopause.
Or in perimenopause?
No, menopause.
Okay. And so what are you supposed to do at that point? Fight it?
You have to I tell people.
Get to Fronzie 3 times?
Exactly. I said, you really gotta step up your exercise and eat clean. Simple as that. Because people are like, I walk my dog. I'm like, okay, walking your dog doesn't cut it any longer. Okay, you can't rely on walking your dog for exercise. I'm like, you really gotta step up. What?
Are there any supplements you can take?
No.
Believe me. You're just getting into weight loss issues now.
That's the biggest. Can I tell you, weight loss, sleeplessness, but I've also had some people go into and I didn't realize this was so common, but I've had several people go into a social anxiety type of thing, and just changes that emotional changes, but even some pretty high profile people have a sudden social anxiety type of thing, and needed some help with that, and it's easy to help, but I mean that was kind of surprising that I've just noticed over the years. But yeah, the weight thing occurs a year after, in the transition without.
And that's till the end, till you're gone.
Yeah, but you know what? But people can stay at the people realize and just step it up. And then there are other people that just don't step it up, and they're like, I'm like, well, you can't just eat that way anymore. So, the sleeplessness, I always give suggestions, is chamomile tea works. Turkey has tryptophan in, which is a natural sleep agent. Going to bed at the regular wake times, regular sleep times, not using computer or electronic devices for 1 to 2 hours before sleep.
Just what we tell our kids.
Yeah, basically, right?
Those are my main suggestions for sleep.
So the IUD, can you keep it all the way up until
Okay, so
menopause?
this is what I love. Yeah, so this is what I love about the IUDs. And you know what? As far as the pills are concerned, so years ago, before I was in training, so I was in training 15 to 19 years ago. We had these 50 microgram pills, which were huge, and then they came down to 35, 30s, 20s, and now they make 110 microgram pill. And the 10 microgram pill is great for my perimenopausal people because it just takes the edge off the symptoms, evens them out. It's terrific. And some advocates advise keeping people on the pill until they're 55 and then taking them off and saying, okay, you're in menopause and we don't know when you went through it. What I usually do is I used to take people off at 50, only about half people would be in menopause, so I would take them off for 2 weeks and I could check a menopausal level. I could check an FSH level. Now, there's only about half. At 51, it's more like 90%, so I take them off at 51. But the IUD is great. There's a Mirena IUD. Before, Mirena came out about 6-7 years ago, I think. Now, Paragard was the only IUD we had. It was a 10-year IUD. It increased your cramping, increased your bleeding. There's a Mirena IUD, progesterone only, no estrogen. Does not go throughout your body, only goes in the uterus and the area around. Our pelvic pain people are using it for endometriosis because they think it does go in the pelvis. And it decreases, you can leave it in for 5 years. You can have spotting, it goes in the office, takes 5 minutes. You can have spot for the first 3 months, however, after 6 to 9 months, little to no period. It's a great thing.
I have that, and I don't know if that's too much, but I have that. And people have asked me, are you worried about not being on the pill because of the breast cancer helping?
I don't think, seriously, I read a lot as far as breast cancer and the pill and stuff like that. There was one thing that I read recently, and that's it. And the majority of the data said there is no effect on breast cancer with the pill, and there is no effect with the IUD because it's progesterone. And even my people, I have a family that has inheritable blood clotting disorder and like a factor V Leiden, and I can use the Mirena IUD with them. So those are like the who was the news reporter that died of factor V during the war and stuff because he had. Did you know what I'm talking about?
Yeah, he was sitting in a.
Yeah, David Bloom. Yeah, because he's factor V. But I have a family of girls that have factor V. So, their dad is homozygous and they all have factor V. So they cannot go on any estrogen. So that's kind of like my spiel. So that's what I try to start to. The average age that people start having irregular periods is 42 to 43. So I always tell my 42 to 43 year olds, less than 21 days, greater than 60 days, or any spotting in between, you let me know, because that is not normal.
So is it possible to be like, go through menopause and just not eat anything? Like
yes.
Not have hot flashes. I know someone.
Yes.
I know someone.
It's not that bad. Matter of fact, it's much better.
Right. It is like you have hot flashes. Like, do you have to do like hormone replacement?
Okay, no. The hormone replacement therapy, they do think increases. Okay, so there was a study out that actually came out when I was pregnant with Kevin. So it's 12 years old. It's called the WHI study, Women's Health Initiative Studies. Huge study, landmark study. They showed a 7 to 8 per 10,000 increased risk of heart attack, breast cancer, and stroke. This is what happened. They took people that were, and this happened to me when I was in medical school. They took people that had been off of, we do think estrogen helps your HDL, your good cholesterol. We do think it benefits your cholesterol, okay? They took people who had been off of HRT for years. Like, they went into menopause at 50, did not have any HRT, nothing. And then they put them on estrogen. Well, they had 20 years to develop plaques because they weren't getting the benefits of estrogen. You give them estrogen, we know can start flicking off the plaques, increased risk of heart attack. When I was in medical school, we used to get consults for the cardiac service. Would estrogen benefit this person? Because we always thought estrogen was a benefit. Now we show there is a increased risk of breast cancer if you are on estrogen and progesterone. So if you have a uterus, you have to be on progesterone. If you're on estrogen only, you will get uterine cancer. So there is an increased risk of breast cancer with estrogen and progesterone HRT. They have not shown a risk at the WHI. Did not show a risk of breast cancer, increased risk of breast cancer with estrogen only. So if you did not have a uterus and you can go on estrogen only, they did not show an increased risk. So a lot of people are not on hormone replacement. However, I do not hesitate. I tell people their risk. I have people that are executives that come in, and they don't even have to have a comment. I can hear them on the phone. They're sobbing to me. They're like, I can't give a presentation. I can't do this. I can't do that. I cannot, I don't care if my life is 5 years shorter, I cannot live this way. I'm like, okay, here's your hormone, I'm like, these are your risks. And you know what, get your mammogram, do self-breast exams. I think it's fine. But there are other alternatives for different things, such as hot flashes. Soy is great, remifemin. I mean, soy is okay, it's not fantastic. Effexor, which is a antidepressant in a low dose, helps with hot flashes. So there are other things that you can use. So you don't have to start an HRT. In fact, the majority of people are not starting an HRT. But some people are still on, and that's fine.
But do women eventually get to an HRT? No, like if you don't, there's not a reason for
People
it.
usually go off, or people, stop menstruating, and then but some people don't have hot flashes. And I really think that exercise does decrease, it helps you, it helps with the sleep, it helps with the hot flashes.
Does vitamin B play into anything?
B complex is great for PMS.
But in terms of, like, I remember, we're all supposed to pay attention to what our mothers went through.
Yeah.
So my mother had to get
No.
shots in the ass.
No, B12.
Yeah, but
B12.
it totally helped.
Oh, really? I
Yes.
don't know. I'm not sure. As far as a perimenopausal thing, not that I know of.
I think it was more about menopausal thing.
Yeah, no, not that I know of. B complex really helps with PMS. So for moods, like if someone says my daughter's moody and I try, I'm like, just try a little bit of D and a little bit of B complex. B complex has just historically helped with moods. And I was operating with with one of the pelvic pain people recently, and she said this, she said the same thing. You just start the B complex on P.
Okay, so quickly, my other comment is, you get pregnant, and there are 5,000 books that you can find, and any
And I hate what to expect when you're expecting.
But you come into this perimenopausal, and I remember,
There's
at 42, like, oh, welcome to the fun thing. And it seems like there's nothing, and you have to have a conversation with a girlfriend, like, me too, really? Oh my gosh.
No, you're right.
Why in this day and age of shared information, is it still such, like, we're stumbling through it?
Yeah, I don't know. Everyone's different though, because people are like,
Well, I know
so
that,
what's going to
but
happen?
remember pregnancies were too,
yeah, no,
right?
I
Like,
agree.
oh, well, that could be pregnancy, or that.
Yeah.
Oh, you.
No, because people come in and they're like, okay, so what's going to happen? And I'm like, what the heck? You know what I mean? Seriously, your periods may get closer apart. They may get further apart. You may just stop. You may go every 5 months. You know what I mean? Call me if you go longer than 2 months. But I know it's hard. There are some books out there. I haven't discovered any good books on that yet.
Can you talk about some of the unusual symptoms that you've heard people like? The reason I ask is because we were in boot camp one time and somebody's like, my scalp is itching.
Hair loss.
Yes.
Hair loss, but hair loss can result from the birth control pill. Hair loss, some people do have, and hair loss from menopause. There is a dermatologist down at U of I that specializes in hair loss, and there was a patient that came into me one December, and she goes, I've had hair loss. I've been to the dermatologist. I recommended testing vitamin D. I always check thyroid with hair loss. And she goes, I have an appointment with that doctor that specializes in hair loss in November. It was December. Next November.
Yeah.
I was like, what? Supposedly, but I had someone that went to her. She prescribes protein and biotin.
Yeah, and HRT too.
Oh, she does prescribe HRT? Yeah. Like little scalp stuff. Testosterone, probably? Yeah.
Yes.
Makes sense.
So hair loss. and
Hair loss is a big one. The social anxiety sometimes happens. The weight gain is just common. Those are like my big ones. I'm trying to think. Those are like my real.
Do you break out again? Like you did?
Some people do. No, more so in perimenopause. The fluctuations, because I think the fluctuations, because it's the estrogen's not at a steady level. At a steady level.
Well, and how about, you keep talking about the weight gain, but how about your body requires so much less? Like, I mean,
Food, right?
right, like all of a sudden you're like, whoa, you feel full, you
you
just
have to
don't
compensate for it.
require the calories, I think.
Mm-hmm.
That, I mean, certainly if you're heavy into athletics and
Yeah,
you're running
exactly.
marathons, maybe so, but.
Yeah. No, I agree. Yeah. And I forget, Nancy, my old office manager, was mentioning something about that every year, I forget how many less calories. Yeah, I agree because I've heard that and I just haven't. But yeah, I don't know any good books right now on perimenopause. I wonder what what's the name's book? She's downtown. I forget. Stryker's book. What was Lauren Stryker's book? I forgot.
Who's the big thick gal who wrote?
Susan Love. Susan Love's breast cancer.
No, this is like women's health.
Don't
You
know.
know, and she does a big section on perimenopause.
So that's it. If you guys have any questions, but you guys can like me on Facebook. I post stuff on Facebook.
Can you say what your blog is?
Oh, I don't have a blog.
Oh, I thought you
I
said
on
on the
Facebook.
blog.
I'm sorry. On Facebook, I do a thing a month. This is the deal. Is that on Facebook because of Corey and Alexis and Andrea, and I do a thing a day to decrease your risk of cancer in just updates on during the month of October. Quite honestly, I'm a mom. I'm a physician that has a full schedule. It takes me like an hour or two because I love just for advice. Take care. Thank you. I love cancer.org, which is the American Cancer's website. And even though I don't like he did, Lance Armstrong's Live Strong is a great reference. Livestrong.org. It's a very good website to look up data and research. Also, one of my favorite cancer sites is Stand Up to Cancer. The entertain. Oh, I have it in the car. Last April 1st edition, 2013 was all about you guys have heard of Stand Up to Cancer? Stand Up to Cancer was the entertainment industry's what they did to decrease your risk of cancer. It's founded by Katie Kirk. And they have the telethon every other year. So what they have, and they create these dream teams. So what universities used to do is they used to work by themselves. And okay, we're going to compete against this university to get. So what Stand Up to Cancer did is put together these dream teams from each of these people from the universities to work together rather than separately to increase the speed at which cancer research can be done. What used to take years now takes months, and because of the amount of funding that they have. And they have also, they go to these people every 6 months and say, what is your research? What have you done? They hold these people accountable, these researchers, to get reports every 6 months. It's incredible. I think Stand Up to Cancer has done an incredible job and incredible breakthroughs. They have a breast cancer dream team, they have a pancreatic dream team, they have a colon cancer dream team, they have a pediatric cancer dream team. And their dream teams and their website is phenomenal. Phenomenal. So that's my but I don't have a blog. I just and I do post stuff throughout the year if I do see something or significant things that have come out in breast cancer research, particularly or an Alzheimer's research or vitamin D or something that I'm interested in.
So you posted on your
Yeah.
Okay.
Yeah.
Are you accepting new patients?
Yeah.
Oh, you are? You're North Shore?
Yeah, oh yeah, I'm not sure.
God,
Yeah, so that's about, that's about it. But again, it's just, like, people, like, don't go out and, like, drastically change, like, you don't have to drastically change things. It's just, like, little things, like the whole celery thing. I was like, I didn't know celery was this beneficial. So I'm like, okay, now that I go up to foodstuffs, I'm like, okay, I'll take a little celery in there, too. And parsley is excellent for pancreatic. Parsley's great. Well, it has this apigenin. But it's just little changes that you can put into your kid's diet. The other thing, one more thing, is I'm big with nitrates, and I try to buy nitrate-free food, although my kids do eat Subway, and they do eat Jimmy John's and stuff like that. And so Kevin goes, can I have a Subway, Mom, for dinner? And he goes, I'll have a thing of berries. I go, okay. As long as you, like, eat a bowl of berries with your Subway, I think it would cancel each other out. So anyways, because nitrates are big with pancreatic, too. Nitrates and are big with cancers. But that's why the garlic and onions, they think, actually destroy the nitrates that form. That's why they think it's big with the GI cancers. It's because it destroys the nitrates that form. So garlic, when you make your broccoli, just put a little garlic in there, and you're getting 2 cancer fighters at once. So, anyways, okay.
That's
You're
great.
welcome.
Thank you.
You're welcome.